Namaskar. So far, we have seen central government medical attendance rules. Now, today we'll see some salient features of central government health scheme (CGHS). This is available only in major cities and towns. Anyway, we'll see in detail now. The central government health scheme facilities are available in more than 70 cities and towns all over India. The CGHS Wellness Center. Wellness Center is nothing but dispensary. Earlier it was called dispensary. Now they have changed it to the name as Wellness. So they take care of our wellness. So that is why it is rechristened as CGHS Wellness Center. They operate in almost all the state and UT headquarters. Only in Northeast region, some places we'll have to say, otherwise all the state headquarters and UT headquarters are all covered. And each dispensary, now it is called as wellness center, will have an area of at least 5 kilometer radius. Normally they will give demarcation and give the areas covered also. In the absence of specific order, people can go up to 5 kilometers, but now that also has been changed with the issue of plastic card. You can go to any wellness center and take treatment. You take card from any one place attached to one place, but you can take treatment, consultation from any of the wellness center all over India, because now plastic card is centralized database system. So earlier all these things, 5 kilometer radius, all those things were there because the records were maintained manually. So the subscriber, that members details, etc., are available only in the particular dispensary you call the wellness center. Now this is not applicable. The rule is still remaining, but now they have issued clear-cut orders with the plastic CGHS card. People can take consultation from any of the wellness center all over India, wherever they are. Okay. Now, central government employees working in CGHS covered city or town can opt for CGHS facility as one-time option, even if they reside in a place not covered by CGHS Wellness Center covered area. What does it mean? Suppose take big cities, like Delhi, Chennai. You can't have a dispensary covering every area. There are outskirts area where the CGHS facility coverage is not there. But you can give an undertaking. There is a format that I will avail from one of the wellness center. That is a base center, let us say. You can go any place. So with that condition, employee can opt for CGHS facility, and then from the day an employee gives such undertaking, the subscriptions will be recovered by the DDO or HO, whatever it is. But this is actually optional. But those who are within the covered area, they can't opt out. We will discuss on those points also. Now, this facility is available for all the central government employees and their families, other than employees of railways and defense. They have their own facility. Railway hospitals are the defense have got their own hospital. That is why they are not covered in CGHS. Otherwise, every central employee is covered. The only condition is the facility should be functioning. CGHS should be functioning in a city or town where the employee is working. This is what is the primary condition. For pensioner, there is another this thing. Assuming that a pensioner who never got CGHS facility, that is, he was working always in an area where the CGHS facility was not functioning, but when he retires, he can opt for CGHS facility from the state headquarters, wherever it is, Or if the state doesn't have, the smaller unit doesn't have CGHS facility, they can choose the nearest state or unity centers headquarters where they can take treatment. As we catch up with the age, I think this facility is essential. So pensioners can opt for, even if they never got CGHS facility at the time of service, they can opt for CGHS facility by subscribing 10 years rate. The highest rate is 1000 rupees per month. That is deputy secretary and above, level 12 and above. So normally the 10-year subscription for the topmost grade for CGHS thing is 1,20,000 rupees. So minimum I think 250, the lowest level. So for this is the monthly subscription. So that monthly subscription multiplied by 12 for 1 year and another 10. So that is the one-time payment for pensioners. So the advantages we'll discuss in detail in the relevant video. You can have fixed medical allowance separately, and this hospitalization through CGHS is also available by paying this subscription. We'll discuss separately in detail in a separate video this particular point. And eligible family members is as similar to CSMA rules. I have made videos on that. You can refer that. Now, PSU, public sector unit, autonomous bodies, absorbees in the sense those who have gone from central government and they were absorbed in autonomous body, PSU, they can continue to have CGHS facility if they want. And other important aspect is when both the spouses are working, one of the spouses can opt for, naturally, at least one of them should be within the CGHS facility. Both of them cannot opt out. So whoever is having a higher salary, because the private ward or the facility is better in when you have higher level, etc. So whichever is advantageous, you can decide, and the higher salary, I mean higher level people can subscribe, and the other spouse can be part of the family, but there is no need to pay subscription by the other spouse. Assuming that suppose husband is in level 9, wife is in 12, so wife can take it because advantage in the sense 9 and 11 private ward I think, but this 12 and above direct consultation some facilities. So it is always better you go for the person who is in the higher level. So the facility and the comfortness is slightly better than lower level people. Women employees can include dependent parents or parents-in-law, either one of them. Assuming that a woman employee whose husband is not in government or public sector, maybe private or whatever it is, business whatever it is, but not working in government. So there they can, the woman employee can include either their parents, only condition their dependency. Their earning is less than 9,000 plus DA, etc. We will discuss that. Or if they don't want to add parents, they can add parents in also husbands, parents, if they are dependent. Dependency is essential. That condition has to be fulfilled, but they can choose. Suppose if both the spouses, husband and wife, are working and both want to subscribe, husband can include their parents and wife can include her parents in her family, and husband can include his parents in his list of family, etc. So you have two different set of things. This facility is also available. It is all optional. But other than spouse and uh, children also up to certain age, earning capacity or something, or unmarried, etc. All rule which is applied in CSMA rules. Same applies here also. With that condition, the dependency condition is not applicable to only spouse. All other people, they have to be dependent. So they can subscribe accordingly. And dependency is calculated, as I already told you, 9,000 rupees per month plus dearness allowance or relief for the particular period. Now, the question arises, there was one query in this. Normally, government releases dearness allowance or relief 2-3 months later, at times 4 months also. So due date will be always from January or July, but it is released in April or September, October. So it is, the eligibility has to be calculated after the issue of orders prospectively. There is no case of checking retrospective thing. It's a small point. The question is, whether somebody wants to add his parents or somebody is earning, or children who started earning, all those things. So January is the DA revision due date, but it is released only in April. So April earning only will be taken into account, not January earning of the dependent people. That is the point here. Now the subscription rate is, before that we will see another point. Employees working in cities and towns where CGHS facility is available and the residential address is within the area of CGHS facility, the CGHS contribution is mandatory, compulsory. Normally, when you join government service or when you are transferred and join in the new place, first they will take certain formats in that residential address also will be collected. So the HO/DDO will start deducting the subscription automatically if you are staying in the covered area. You have to say, suppose your spouse in some public sector or other department and you are giving joint declaration for availing facility from spouse department, you have to give in writing that joint declaration, which will be signed by your department HO and the HO of the spouse also, and each department will have one copy each. With that only they will stop subscription recovery and all. So this is as far as subscription is concerned. If the residential address is within the covered area, the recovery is automatic. Whether you avail CGHS facility or not is immaterial. If you opt out under the condition that your spouse is having government sponsored, public sector sponsored facility, you can't compare private sector's private sector's medical facility. That is not taken into account. Whether they have or not, you have to subscribe and automatically you become a member of the CGHS facilities. Now, both the spouse I already told, and joint declaration part also we have discussed. Now the subscription rate is up to level 5, 250 rupees per month. Level 6, 450. Level 7, 8, 9, 10 and 11, 650 per month. Level 12 and above, 1000 rupees per month. And for pensioners, I have already discussed. Now let us see other aspects of CGHS in the next video. Thank you.